And I'll let you do your thing.
All right, thanks, Carolyn.
Amanda, are you okay?
Went out for a second.
All right. I'm turning it over to you.
All right. Welcome, everybody, to our first Teen Health Science Cafe of the fall 2020 semester. This is completely virtual, and we are live streaming, so we're excited to have everybody present. If you have any questions, whether you're on Facebook or YouTube, feel free to throw them up in the comments. We'll see that. At some point during Alicia's presentation, she'll have a nice activity plan, and that is where our comment bar will definitely come in handy for all of you guys. Today we are joined by our speaker, Alicia Snyder. She is a respiratory therapist in our school of the College of Health and Human Services. We are very excited to have her come and speak with you guys. So if you guys can all just back and enjoy her presentation, we will let her start.
All right. Well, first of all, thank you all for being here. I know it's a little bit different of a format than we're used to, but I really appreciate you all taking the time to be here. And I will have a PowerPoint presentation for us. And then, as Amanda said, we will try to do a fun game. We will do a Jeopardy game. So stay tuned for that. So right now I'll pull my PowerPoint slides up for you. So as Amanda said, my name is Alicia Snyder. I'm a respiratory therapist. I actually went to school at NKU for 2 of my degrees, so I'm really happy and excited to be back at Northern Kentucky University. So I'll tell you guys a little bit more about myself here in a moment. But what we're going to talk about today, we'll talk a little bit about protecting lung health. So we'll talk about past and present dangers to our lungs, some current issues that we're facing, and the role of the respiratory therapist. So some of you may even be asking yourselves, what is a respiratory therapist? Maybe you've heard of a respiratory therapist before. Maybe you know somebody, or you may have even heard of respiratory therapists with all the press with COVID-19 these days. With it being a respiratory illness, there has been a lot of press about respiratory therapists. So we'll talk a little bit about what a respiratory therapist is, some of the career options for respiratory therapists, and then we'll get into some of the other lung issues of today. So what is a respiratory therapist? You may also hear it said as an RT. RT would stand for a respiratory therapist in the hospital, but they are a certified or registered medical professional who specializes in providing healthcare for your lungs. We do have an advanced knowledge of a lot of high-tech equipment, such as a mechanical ventilator. Maybe you've had a family member or have known somebody that needed some help with their breathing with a machine, and that would be a mechanical ventilator. So as respiratory therapists, we do checks and we set up and do a lot of work with the high-tech equipment. RTs work alongside doctors and nurses, other healthcare professionals, and primarily in the hospital setting. But we'll talk about some of the other avenues you could explore if you're interested in the field. So here's a quick little fact check. How long has the field of respiratory therapy been around? So if you can type in your guess. So how long you think the respiratory therapy field has been around. And then I'll have to see if I can see the comment. So I'm not sure if I'll be able to see your comments, so I may have to look back at those, or if Amanda can see them. But surprisingly, it hasn't really been around that long. Around since the 1950s. There were a couple things that happened a little bit in decades before that, but around 1950 is when the AMA, the American Medical Association, adopted in New York the creation of schools of inhalation therapy. And this was really the beginning of the start of respiratory therapy as a field. So it may or may not have surprised you. So it's not a field that has been around quite as long as, say, nursing, but we are getting up there. So hopefully you thought about that. So what are some other things that a respiratory therapist could do? We do treat a wide range of patients, anywhere from if you wanted to work in a NICU with neonatal, very tiny babies, all the way up to the elderly, maybe in a skilled nursing facility. So you really can work with patients of all age ranges. Oftentimes we're teaching patients how to use our medications, teaching them how to use equipment, checking equipment. We also are an important part of the team. So part of our job would be to consult with physicians, other healthcare staff. It's really important these days that we're working with the patient, with the other members of the healthcare team to create an individual patient plan, care plan. So before the patient leaves the hospital, or when we're doing follow-up with patients at home, we need to have an individualized care plan for the patient, and that's what we can help with. And then, as we've kind of already mentioned, we perform regular checks on patient equipment and the patient themselves. And that could be at home in a home care setting, that could be at the hospital. So a variety of settings. So where do we work? Respiratory therapists, and again, you may be familiar with the field, you may not, but primarily you'll at least start your career most likely at a hospital. But your career could take you many different places. If you really like excitement and adrenaline rush, respiratory therapists are a member in many institutions of the transport team. So that could mean that you're riding alongside in an ambulance, a plane, a helicopter. Children's has respiratory therapists on the transport team in the Cincinnati area, so that's an option there. You also could be working in home care. So many times there are patients that maybe need oxygen at home, or you may even know a family member that maybe has what they call a CPAP machine. Some people need to wear a machine at night to help them breathe while they're sleeping. So many times respiratory therapists set those machines up and provide care for that. Sometimes you even find respiratory therapists at city schools. So at Children's, we also had a program when I was in the pulmonary clinic where we would go out to city schools. And we could actually do breathing tests with kids, and we could help them with their medications. So that was another thing that you can do. And a pulmonary clinic. So one of the jobs that I had as well, most recently, a couple years back, was in a pulmonary clinic. So that was a really interesting job. So what do? Respiratory therapists assess patients. We give help to people with breathing problems. So there are all kinds of reasons people can need help with breathing. With their breathing, and we're there to help. We also give breathing treatments, so you may have had breathing treatments yourself, or you may know people. Sometimes they're nebulizers, sometimes it's what we call an MDI or an inhaler. We also do a lot of different therapies with patients that can help them if they're unable to cough, or if they have mucus or sputum in their lungs, we can help them get it out of their lungs. So that's one of the things that we can do. There's many different therapies that we can do for that. We also, again, if you really like equipment, you like kind of high-tech things, you like computers, you may like respiratory therapy, because we do work with a lot of advanced equipment, like ventilators, different machines that would give you pressure to help a patient while they're breathing. And there's a lot of very interesting very neat technology that is out there today with mechanical ventilators. We also obtain blood samples. So sometimes our blood samples are a little bit different than what a nurse would obtain, because we actually obtain blood from an artery instead of a vein many times. So it's a little bit different than getting a venous sample of blood. But we do help obtain blood samples at times. And another really important role that I'm very passionate about is that we can be there for the patient to provide education on medications, on any therapies they may be ordered on. Also, if you've heard of pulmonary rehabilitation, sometimes people with chronic lung disease will benefit from certain exercises and things that we can work with the patient on. And smoking cessation. So that's another really important thing. Is helping people, being a support if they want to quit smoking. So it's a really important job for a respiratory therapist. So just let me know if there are any questions. Hopefully Amanda can let me know. So how did my role or journey start as a respiratory therapist? So I actually started at NKU, and I had just 2 years of general studies. I wasn't sure what I wanted to do, so I just was taking, all of my general study courses. I was undecided on my major. I was kind of flipping through the catalog, wondering what I was going to do. I'd always been interested in the medical field. I even at one point had said that I'd wanted to be a doctor when I was younger. But I ended up deciding, that wasn't for me. I also knew nursing wasn't quite for me, but I was flipping through the catalog and saw respiratory care, and I was immediately intrigued. I had had asthma as a child. I'd had to do nebulizer treatments, had to get allergy shots. I'd had a lot of issues as a child with my breathing. So I instantly was intrigued, and I thought, I would like, I think this might be for me. I would like to help others who have trouble breathing. So I ended up going into respiratory care. At the time, it was just an associate's degree. So that meant that I had 2 years of further studies to get my associate's degree in respiratory care. Well, I started at the Christ Hospital in adult care, was there for, maybe about 1.5 years, 2 years. And then I decided to take a little bit of a leap of faith and go work with children. So I actually started or made a change to Cincinnati Children's Hospital Medical Center. And through that, I was able to go back and get my bachelor's degree. That was also at Northern Kentucky University in health science. And then I later went back to get my master's degree in respiratory care leadership. And then I also did a minor in adult learning theory. So if you're interested in teaching, that's something that you could consider as well. So at Children's, I worked there for a little over 14 years. I was in what we called the PICU, which was a pediatric intensive care unit, for over 10 years. And then I was an educator there for a few years. And then I ended my career there at the pulmonary clinic. So I saw a wide variety of patients. The really neat thing about the PICU was that we would see anywhere from little babies all the way up to adult-sized patients. So it was really neat. So that was a great experience. In 2019, last year, I came back to NKU as a professor. So again, very excited to be back here at Northern Kentucky University. It's always felt like home to me, and so I'm glad to be back. And I will talk to you guys a little bit later about our program here if you're interested. So where could your career take you? So I told you, kind of where my career path took me. And not everybody's interested in pediatrics. It's definitely something that you either are or you aren't. But what could interest you? So maybe you're interested in management. So with a 4-year degree currently, you can be a manager of a respiratory care department or of a unit somewhere. So maybe you're interested in more of a leadership role. You definitely could find your niche or your passion in bedside care. And from all kinds of patient types, from a NICU setting, maybe you're interested in people with cystic fibrosis, maybe people with asthma. So you can definitely find your passion in bedside care. As I mentioned before, we often are involved in pulmonary rehab. I actually did that at Children's as well in the pulmonary clinic, but it was really neat. We had patients come in, and we would, have different exercises that we would do alongside and with them, teaching them how to breathe, how to get stronger, how to not be short of breath when they were working out. So that was really exciting. And I did what we call pulmonary function testing. So it's all kinds of different ways we would ask patients to breathe. And what we would do, we would get information about their lung volumes for the doctor to use. So that was really neat too. You could be on a transport team. Like I said, if you're really into adrenaline, you might want to work in an emergency department or with a transport team. So that's one avenue you can take. Another way is through sales. So I've also had some friends that are respiratory therapists that actually went into jobs where they traveled and they were involved in sales of maybe medical equipment. It could be specific to respiratory care. It could even be more general medical equipment. So, I've known several RTs that like to travel that did that. You could also be an educator. So not only at a college, teaching students, college students, but you also could be an educator at a hospital. So I was an educator for a few years at Children's, and we were in charge of orientation. We were in charge of education for any new therapies or new equipment that came out. So that was a really exciting job, and that might be something that you find rewarding. So another really cool thing about respiratory therapy is that you can obtain a lot of specialty credentials. So when you're done with school, with your program, you will sit for a national board, a national test, and when you pass, you become a registered respiratory therapist, just kind of like, I shouldn't say just like, but very similar to how you would become a registered nurse if you were in nursing. So you will sit and become a registered respiratory therapist. But then as you move along and you develop different areas of interest, you can also obtain many different specialty credentials. So that's what we call them. But those are additional tests that you can sit for. You take a national test again, but you get a specialized credential. One that I have is a neo-ped specialty one. It's an NPS. You can also do an adult critical care, ACCS. You can get a pulmonary function testing, which I also have, which is the RPFT that you see behind my name. You also can get one in sleep disorders. So I didn't talk about this yet, but there are respiratory therapists who work in what we call sleep labs. So they are doing testing on patients while they sleep. Sometimes it's to see whether they need a mechanical ventilator at night. It could be to see whether they need a CPAP unit at night, or maybe if they need oxygen. So you also can do a sleep disorder certification. Another really interesting thing you can do is if you really are interested in asthma, or maybe you have asthma yourself, or you have family members with asthma, we can take an asthma educator certification. So you can become certified to teach people with asthma. So that's another really cool thing. But the list goes on. There's all kinds of places this can take you, all kinds of things that you could become interested in. So if you have any questions about those, I'll try to answer questions at the end. So hopefully everybody kind of is intrigued so far about respiratory. So what about lung health? When we're talking about lung health, you may or may not know some lung conditions are genetic. What does genetic mean? That would mean that the patient is born with them. So nothing that they did caused this disease, they're just born with it. So some of the respiratory examples would be asthma or cystic fibrosis. So you may have heard of one or the other of those, or maybe both. But both of these types of patients work very closely with respiratory therapists to maintain optimal lung health. So we'll be working side by side, hand in hand with the patient to try to have the best medical or optimal health outcomes for the patient. So the respiratory therapist has a very important role many times in educating families about the medications these patients will need and some therapies that the patient may need. So some of you may even have asthma or know somebody with one of these conditions yourself. But these are definitely, groups that we work very closely with. And then we'll talk a little bit about some health issues are what we call acquired. And what does this mean? Well, it means that it could have been prevented. So there's some type of behavior or thing that this person is exposed to that leads to an acquired disease. So one example is, if somebody smokes or vapes, we know a lot about smoking. We now know, we're starting to know more about vaping, but it can lead to a lot of potential lung complications and disease. So as respiratory therapist, or if it's something that interests you, you can do the same. You could have an important role in educating young people. For me, it might be patients, it might be my college students, but we can educate people on the potential dangers, on prevention, and if they're interested in stopping smoking or vaping, then we call it cessation. So we can try to help people, give them the tools that they need to quit smoking or vaping. So interestingly enough, in the United States, tobacco use is the leading cause of preventable disease disability, and death. And again, that's here in the United States. Interestingly enough as well, and this may be no surprise to you, but most tobacco product use begins during adolescence, probably around middle school, maybe high school years. So in recent years, tobacco products have evolved to include various smoked, smokeless, and electronic products. And you may know people that use these type of products. But this all came from this worldwide report, this MMWR report that I have referenced at the end of our slides. A lot of the information and almost all of the graphics that I've used as well come from the CDC, which I've also have links in the reference page at the end of my slide. But the CDC, and it's just free, you can Google it, but they have a wealth of information about the dangers of smoking, the dangers of vaping, and they have a lot of tools for both clinicians and also for anybody that maybe knows somebody that wants to quit smoking or wants more information. So it's a great resource you can go to. So really in life, we all want to be partners with medical professionals for providing our own medical care. You know, knowledge is power. If you or somebody you know has asthma, you can take an important role in learning how or helping them learn how to take their breathing medications. You can always check with a medical professional too to make sure you're taking them correctly, using them correctly. So we can, you know, our health is oftentimes largely in our own hands, and we can work just as closely with a medical professional to try to make sure that we're in optimal health and that we're thinking about our own health. If you have asthma or allergies, one thing that you can also do is know the triggers. So what does triggers mean? Well, there are certain things that if people with asthma or allergies are exposed to, that it may cause them to have some trouble with their breathing. You know, some common examples would be like dust, pet dander. Sometimes people are allergic to a certain type of pet. It could be things that are in our air, just like right now. A lot of people have trouble in the fall or springtime, you know, when there's a lot of pollen in the air or when leaves are falling. So, you know, everybody may have a different trigger that maybe affects their breathing. So if you have allergies or asthma, you would want to know your triggers and you would want to avoid them as much as possible. Another just general thing that we all can do as humans, you know, make sure that you're considering healthy habits for yourself, like getting plenty of sleep, making healthy food choices, staying hydrated. So hydration can be really helpful, even to our lung health. So just think about all those choices that you're making. So now we'll talk a little bit about, so I mentioned to you, you know, that some of the dangers, still present dangers that we have in our society would be cigarette smoking. And we'll also talk about now the more current issue of e-cigarettes or vaping. So first of all, cigarettes. This came from the CDC as well, from one of their graphics, but this kind of shows how a cigarette is engineered. If you kind of look over here, it shows you everything that's in there. You know, they have the fillers, the paper, the tobacco filler. But then what they show you is that there are all kinds of additives. So you may not know this, or you may already be aware that there are many, many different additives in cigarettes. And if you really look at what they are, it's quite shocking or surprising, or at least to me it was. For instance, and I've got them listed out here, but for instance, acetone. So where have you heard acetone before? That's what's found in most nail polish removers. So, you know, in cigarettes, there's also acetone. Acetic acid, that's an ingredient that's in hair dye. Arsenic, which is used in rat poison. And the list goes on, but some of the other ones that we'll talk about, there's a component that is found in battery acid. There's butane that's found in lighter fluid, formaldehyde and embalming fluid. Lead, most of us have heard of lead and know that it's a very dangerous substance. Another one would be methanol. Also nicotine. So you've probably heard at one point or another about nicotine. So keep in mind that nicotine is also used as an insecticide, and nicotine has very addictive properties. So it can be very addictive to our brains when we're exposed to nicotine. Also tar. So material we use to drive on the street, we drive our car over it. Tar is found in a cigarette. So, there's a few other ones too, but I found the ones that I mentioned to be very shocking. And it's just kind of common sense. Like when we really think about it that way, do we really want all of those additives into our lungs? Probably not. So just kind of shocking when you think about it. So current issues, and this came from a 2019 survey, tobacco use survey. Although we have found in general in current times that cigarette use is on the decline, another current concern that we have, especially with young people, again, that, kind of middle school, high school range, this survey was high school students, is the growing concern of the use of e-cigarettes and vaping. So you can see in our little infographic here, about 31% of those in this, national survey said that they had used any tobacco product. But 27.5% of that 31% noted that they were using e-cigarettes. So you can see that cigarettes have, really dropped off. It was only about 5.8% of the survey. So one of our growing concerns would be e-cigarettes. So you might think to yourself, or you may even be under the impression, or you may have even heard, oh, e-cigarettes are better than cigarettes. So are they really? So we'll kind of talk about that. So what are you breathing in? And keep in mind, just the same with cigarettes, you're also blowing out everything that you're putting into your lungs. So those around you could breathe these same chemicals in. So what's in an e-cigarette? Well, this is a little graphic and we'll look at it in a slide as well. But you might be surprised to know that in your e-cigarette, you're probably going to find cancer-causing chemicals, heavy metals such as nickel, tin, and lead, flavoring. One example they give is diacetyl, but they put flavoring and they put oils in the e-cigarettes that have been linked to what we now are finding is a serious lung disease. You may have heard of popcorn lung. They're also calling it E-Valley, E-V-A-L-I. But they're finding that some people are getting this really serious lung injury from an e-cigarette. They also many times have nicotine. It also is a very ultrafine particle. So what I know as a respiratory therapist is that means that the smaller the particles are, the deeper they may be getting into your lungs. So you may be breathing all these chemicals, very deep into your lungs. So what's in it? Kind of listed them out there again. Surprisingly, even if they are marketed as not containing nicotine, when they are studied, most e-cigarettes still contain nicotine. So what that means too is you'd want to be careful if you're not only smoking but also using e-cigarettes. You need to be very careful because you could be taking in even more nicotine than you're aware of. Again, the particles are going to get very deep into your lungs. We're worried about some of the flavoring, some of the oils that they use. Vitamin E has been found to be kind of dangerous too. So again, we're worried about some of these different chemicals that are in them. Cancer-causing chemicals, nickel, tin, and lead. Probably not things that, again, we want into our cigarettes. So it's very difficult for consumers to know what's actually in their e-cigarette products. Again, some are found to have nicotine when they claim not to. So we won't go here now, but there's also a lot of great information at the CDC website about e-cigarettes. So what can you do to keep your lungs healthy now and in the future? Lung health is very important. We have to breathe. Breathing is essential to life, so it's very important. So you want to do the best that you can to keep yourself healthy in general, but also your lungs. So what can you do? Stay informed. So know the risks. Think not only about the present, but also your future. It may seem far away. I know I've been young. When I was in middle school, people that were in their 30s seemed so old. Definitely people in their 40s seemed old. But now as I'm getting older, I realize that it doesn't seem old to me at all. And your parents or relatives may tell you the same thing. You never think things are going to happen to you, but do not be fooled. You need to think about your future even now. Your future self will thank you. Another thing you can do is help spread awareness to others. So, you want to do it in a very kind, caring, respectful way, but you might want to make sure that your friends know what are in, if they're using e-cigarettes, if they're vaping, kind of make sure that they're aware of some of the risks that they could be facing when they use these products. And we may even find more out as time goes on. They'll probably study it more and more. And then, it's really hard when you're in middle school and you're in high school at times, but be brave enough to take a stand. We know that it takes a lot more courage to do the right thing many times than just going along with the crowd and not saying anything. So, be brave enough to take a stand. If you know that something's not good for you, think about being okay taking a stand against it. And just remember that we're all original, we're all wonderful creations. There's no one else just like you. You were made, uniquely. So just take care of yourself. Know what's healthy and right for you, and just be proud to take a stand. So you can be too, but a respiratory therapist definitely should be a champion for lung health. We're there to promote smoking and vaping cessation. We're there to spread, awareness about the risks. So you can be the same, though. You don't have to be a respiratory therapist to be the same way. So now I believe we have time. So what I was going to show you is, you might be asking yourself, well, how many respiratory jobs are out there? What type of salary do they make? And those are all great questions, and you may be surprised. So we will take a look. This is a separate site, so I'm going to try to make it a little bit bigger for you here. This is pretty recent information. It's 2019. It's probably the most recent, at least it was the most recent I could find. But this is from the Occupational Outlook Handbook. But for quick facts about respiratory therapists, so the 2019 median pay was around $61,000 a year. So in my opinion, that's a pretty good salary. So what does that mean per hour? Probably somewhere around $29.48 an hour. So keep in mind that's a median pay. So when you start off, you'll probably be a little bit less, and there are definitely people making more than that. That's kind of the middle range there. The typical entry level is an associate's degree, although by 2030, our field will transition to being all four-year bachelor's degrees. And I'm very excited about that. Just like nursing has kind of shifted to bachelor's degrees, it's the same for our field. Number of jobs, according to these numbers from 2019, we had about 135,800 jobs, so just under 136,000. What is the job outlook? And this is from 2019 to 2029. It's expected to increase by 19%, so that actually is much faster than average. So it's expected to grow. And one thing that's kind of anecdotally, it's not good. Everybody hates that COVID-19 is around, but one thing that it has done is brought attention to our field as respiratory therapists. So I would anticipate that the field will only continue to grow, and that interest in this field of being an RT will only continue to rise. So hopefully you guys will you can always go back to that and take a look if you'd like. So could this profession be for you? So respiratory therapists, we really can be real life heroes. We're working hand in hand, helping people breathe. What could be better than to help somebody breathe? There's nothing worse when you aren't able to catch your breath or breathe. So you might be wondering about our program here at NKU. So we have gone to a four-year program, which I think is just wonderful. We do have 1 year of prerequisites that you will take before you're actually admitted into the respiratory care program. So if you know this is what you want to do, you will take your prerequisites that first year, and then you will go ahead and enter the program to finish up your last 3 years. Your last 3 years, you will take all of your respiratory classes, but you'll also have some other electives and some other disciplines as well, like biology, things like that, your A&P, anatomy and physiology. At the very end of the program, you will be prepared to sit for that, our National Board of Respiratory Care, for the therapist multiple choice exam. And that will be when you will become a registered respiratory therapist. So we used to have certified respiratory therapists, but again, we're going to only registered, which is a good thing. If you are wondering, I do have a link to our NKU. Here's our, as Amanda said at the beginning, we are under the College of Health and Human Services. So radiology is also under the same college, you know, a lot of our different colleges together. But this is our Bachelor of Science in Respiratory Care. It talks about, you know, if you want more information, you can look at everything. Tom Baxter is our director. Dr. Baxter is the director of the Respiratory Care program. One thing that I wanted to mention to you guys, and I double checked with him, and the stats have stayed the same in the last several years, we have a 100% job placement rate. So every single one of our, from 2012 till last year, every single one of our graduating students has had a job before they graduated. So anyway, you can find more information about it if you would like. We have a lot of clinical affiliations with a lot of area hospitals, and this could even be updated further because we have added even more, but we do have a lot of area hospitals that you will go to and you will do clinicals. So that's really cool too. You can get a job. Oh, I didn't put this on here, but you can actually get a job after your first semester in that second year, your sophomore year. After that first semester, you can get a job as a respiratory care student. And I believe the pay is somewhere around $15 to $16 an hour, maybe even a little bit more. But you begin after that first semester, that sophomore year, and you can work anywhere in the city. You'll get to know people when you're out in clinicals. You can apply for jobs. All of our students, you know, in the sophomore and junior classes have jobs. So they're learning, making money, also learning alongside of their clinicals. So that's really cool and exciting, I think. So this is a really good quote that I wanted to kind of end before we get to our activity with. It's a Ralph Waldo Emerson. It's kind of grainy, so you can't see that below, but it's Ralph Waldo Emerson. But the quote is, "To know even one life has breathed easier because you have lived. This is to have succeeded." So this quote really speaks to me as a respiratory therapist, but, you know, all of us could help people breathe easier, right? A really cool RT quote. So we'll try to get to questions too. So I'll kind of try to get out and look and make sure there are no questions before we go on to Jeopardy. I'll get out of here. So, any questions before we go on to Jeopardy? So I think, was that a comment from Bailey? Cool. Now, I was the same way. I also wanted to be, you know, I thought a pediatrician or a doctor for many, many years. You know, I kind of had a change of heart. I ended up not wanting to go to school for as long. You know, I was a little bit nervous about, you know, feeling all the weight of being, you know, making all the decisions in the orders. So yeah, so maybe this is something you want to think about. But if anybody has any questions, there'll be a little time at the end here for Q&As as well. So if you think of anything in the meantime. So what we will probably do is we're going to try to do a fun activity, a Jeopardy game. So I was not able to add the Jeopardy music at this time. We may add it later, but we're going to play a little Jeopardy game. And I will give you guys the answers. I was hoping our screen would be a little bigger, but hopefully you can see. So we're going to have 4 categories here. So the first one is, you want me to breathe that into my lungs, ? And then the second category is, what is a respiratory therapist? The third category is protecting lung health. And the fourth is, if I were a student at NKU in respiratory care. So I'm not sure if I'll be able to see your answers, so we may just have to kind of go back, but I want you guys to play alone if you can, try to give some answers here. So I'll probably have to choose it. but e-cigarettes contain these type of heavy metals. So I want you to think back to the types of heavy metals. I'll give you guys a few more seconds here. Final answers. Think in your mind what heavy metals were in e-cigarettes. Hopefully you recalled that it was nickel, tin, and lead. So kind of creepy when you think about it, right? Okay, we'll maybe do all the tins starting because I know it will be a little bit hard for you guys to choose. So the field of respiratory care began to form more formally with schooling in what decade? Let's see if you guys can recall that. Give you a few more seconds. And actually, maybe I can. So that is the 1950s. Hopefully you recalled that. All right, so we'll do the other 10. We'll go to protecting lung health. So this is what we noted in the United States, at least, to be the leading cause of preventable disease, disability, and death. Leading cause. Okay, so hopefully you remembered that was tobacco use. So still here in the United States, even with all we know about smoking now, all the bans they've put in place, still the leading cause. All right, we'll do if I were a student at NKU in respiratory care. When could I begin working as a student if I were in the respiratory care program? So this might be a little bit trickier to remember. And I noticed after that I spelled sophomore wrong, so pay no attention to that. Pretend that has another O there. But it would be after that first semester of what we call your first professional year, which would be your sophomore year of college. So that's when you can begin working with your student license. And so you may be wondering, well, how do they know what I'm able to do with patients? Well, everything that you've been checked off on in the lab. So you'll practice a lot of skills in the lab. You'll go see patients in clinicals first. And then once you've been checked off on a certain set of skills, then we update your license. So as you go along and learn more, you can gradually do more under your student license. So that's really neat too. All right, well, do you want me to breathe that into my lungs for 20? So cigarettes contain this substance that is also used to pave the roads. This might be an easy one for you. Hopefully you've collected your answer, and it is tar. So very crazy, right? That people that are breathing in cigarettes are breathing in tar. All right, now we'll do what is a respiratory therapist for 20. Around how many respiratory therapists are there working in the United States? Again, just remembering that number. You may not. That's okay if not. But according to the 2019 data, at least, around 136,000. They said 135,800. Again, I think that number will increase because more people are finding out what we are. All right, protecting lung health for 20. Name a genetic condition that may require care from a respiratory therapist. This may be a really easy one. You may have to think for a second. There are all kinds too. These aren't the only ones, but these are some common ones. So we do see a lot of patients with asthma. We do see a lot of patients with cystic fibrosis. So two that you may work with. All right, so we'll go to if I were a student at NKU in respiratory care. What has the job placement rate been for graduates here at NKU in our BSRC program? What is that job placement rate? And I did verify with Dr. Baxter. We are still holding steady at 100%. So everybody that's graduated has had a job lined up, which is super awesome. All righty. Alrighty, we'll go to, you want me to breathe that into my lungs for 30. And sorry, you guys can't choose with the virtual format. It's a little bit tricky. Okay, so this is the most commonly used tobacco product among that survey among high school students. Could be middle school too, but this was a survey with high school. I'll give you just a few more seconds here. You may recall it was e-cigarettes or also vaping. So the good news is cigarette use is on the decline, but the bad news is e-cigarettes are on the rise. So we'll go to what is a respiratory therapist for 30. So what type of degree does NKU offer in respiratory care? Give you just another second to think about that. Maybe type if you want to type your answer in. So we have gone to exclusively a 4-year bachelor's degree program, which, like I said, by 2030, everybody will be 4-year. But the really cool thing now, if you get a bachelor's degree, is it gives you a lot more job opportunities right now. To be a manager, you need a 4-year degree. For other sales positions, you may as well. So really awesome. All right, we'll go to protecting lung health for 30. E-cigarettes and cigarettes have chemicals that are known to cause what disease? This disease causes abnormal cell growth or even tumors. This one may be really, you might be like, oh, I know this one. That was really easy. But just keep, as we know, they have those chemicals that can lead to lung cancer. And just so you know, it's not always a known fact. Some people that end up with lung cancer never smoked. So not everybody that has lung cancer smoked, but the majority do. So typically you have smoked if you end up with lung cancer. But like I said, not everybody. It's just one of the things that can lead to lung cancer. So if I were a respiratory therapist student here at NKU, this name, so there's things that we have students do. So this refers to activities we would have our students do, where we do pretend patient scenarios. We use dummies, or we call them mannequins, to practice skills. And the really cool thing is we can hook these dummies up to computers. They can talk and interact with you as well. So what do we call that? We actually call that simulations. So if you were a respiratory therapist student in NKU, you will have a lot of hands-on practice in the lab. And I teach a lot of the lab, so I'm working side by side with you, practicing skills before you ever see a patient. Then you also will have clinical scenarios with real life patients where you're with a registered respiratory therapist, and you will do simulations at times with these mannequins or dummies. So it's really cool too. A variety of learning experiences. All right, so we'll go to, you want me to breathe that into your lungs for 40. This ingredient in e-cigarettes has been linked to serious lung injury or disease. And if you remember me saying, they kind of had a name for this that was called popcorn lung or E-Valley, which is acute lung injury. So drum roll, what is our answer? That would be the flavoring in the e-cigarettes. And the example they give is diacetyl, so one of the flavorings. All right, we'll go to what is a respiratory therapist for 40. Respiratory therapists provide patient education on topics such as, so if you remember back, there's all kinds, but if you remember back to some of the examples I gave. So some of these are very, very important, passionate to my heart. But oftentimes we're educating on medication, when and how to take it, therapies. If you remember, there's a lot of airway clearance therapies, pulmonary rehab exercises, breathing exercises people can do at home, and last but not least, smoking or vaping cessation. So, all right, we'll try to keep moving along here so we stay on track here. Protecting lung health for 40. So a person with asthma may have to avoid certain things such as pet dander, dust, maybe being outside at certain times of the year. What is the name for these things that they have to avoid? So I'll give you a moment to think back on that. And you may already know this if you have asthma or allergies, but we would call these triggers. So part of education for somebody with asthma would be to find out and to know what their triggers are. And then hopefully they would avoid them. All right, we will go to if I were a student at NKU in respiratory care. There we go. So this is the name for a student that will spend time in area hospitals alongside a working respiratory therapist. What do we call this student? So this would be clinicals or your clinical rotation time. So I guess it's not the name of the student, but the time that you spend. You go certain days, you're assigned to a hospital in the area, you're with a registered respiratory therapist, you're going alongside of them while they're working, learning. So we call that clinicals or clinical rotations. And our other programs have clinicals too, nursing, radiology, we all have clinicals built in. All right, our last category for all. You want me to breathe that into my lungs for 50. This addictive substance can be found in almost all e-cigarettes and all cigarettes. So almost all e-cigarettes, every single one of cigarettes, typically. And that would be nicotine. So remember, do not be fooled. Don't think that your e-cigarette doesn't have nicotine or harmful substances. Many times they do. All right, we'll go to what is a respiratory therapist for 50? What age of patients might the respiratory therapist see? So who could you see depending on where you work, what your interests are? So I'll give you just another second there in case you wanted to type. But that is anywhere from neonatal, very, very tiny premature babies in a NICU, all the way up to the elderly in like a skilled nursing facility. Very good. All right, we'll do protecting lung health for 50. We're almost done here. So 27.5% of high school students that were surveyed said they have used what type of tobacco product? So this probably came right to your mind. I know we talked about it a couple times, but e-cigarettes. So keep in mind, many of these little e-cigarette devices too are very tiny. They may even look like a USB port or a pen. So they're very portable, very easy to conceal as well, which makes them kind of even more dangerous. All right, last but not least, if I were a student at NKU in respiratory care, at the end of my college courses, I would need to take what kind of national test if you were a student here at NKU in the BSRT program? And that is the Therapist Multiple Choice Registry Exam. So you would pass it because you would be very well prepared. And you would end up what we call an RRT, a Registered Respiratory Therapist. All right, so that was the end of our Jeopardy here, guys. We will get back out here. All right, and that was the end. So do we have some questions? Or maybe I can go to comments. Oh, great job. So yeah, I see you guys were answering along. Thank you for playing along. So let me see if I can see some of the questions here. And thank you guys again for answering and playing along.
Alicia, are you able to see the little blurbs at the bottom?
I can now. I went to the comment section.
Okay.
See that there's the question about you musician. I know that what comes to mind offhand might be some of those breathing techniques that I mentioned that we can teach our chronic lung patients to do, like pursed lip breathing. There's something called abdominal breathing, but there are different, breathing exercises that can not only help you relax, but can also help you empty your lungs of air. And then I have had some patients A pulmonary rehab patient has told me this, or some of my asthmatic patients who have said that, the different breathing training that they do while they're in band actually makes them feel like it helps their lungs as well. So it would depend on what kind of breathing problem you're having. If your problem is bronchoconstriction from asthma, you might need to pre-medicate before you play your instrument, maybe 20 minutes before, just like somebody that has exercise-induced asthma. So if they have allergy symptoms when they're exercising, these patients often have to take a medication prior to exercise, maybe 20 minutes before, so that they relax and open up their airways before they play their instrument. So it really kind of depend on the reason why. If it was somebody with like COPD or emphysema that has a chronic obstructive pulmonary disease that's, a little bit older, maybe caused from smoking, then they might benefit from some of those breathing exercises I mentioned, like pursed lip breathing, abdominal belly breathing. So hopefully that kind of answered your question there, Gabriel. And I saw the comment about wanting to be pediatrician, so that would be a great goal as well. But if you end up, changing your mind, this might be something you could look into. Is it Tashiana? Great comment there. And Bailey, I'm glad that you found it interesting. Yeah, I really appreciate you guys, viewing the presentation and participating. Yeah, very glad to have you. I do not think I see any other questions that you guys might have. Hopefully, even if this isn't the field for you, my hope would be that you still, found something very interesting from the presentation. And I really appreciate you guys being here.
All right.
So,
Amanda, you want to close us out and let them know about the raffle prize?
Yeah, I can do that. So thank everybody for attending, whether you were on YouTube or on Facebook. It was a real pleasure. Thank you, Bailey and Gabriel, for participating in our Jeopardy game.
thank you.
You will be receiving a link here soon via email for a evaluation. If you fill this out, you'll be entered in a chance to win a raffle prize, which is a portable photo printer, which is really cool. So we're really excited about that. We also have a Teen Health Science Cafe coming in October. Our presenter is from the School of Mathematics. His name is Axel Brandt, and he will be talking about pandemics and how they spread. And his focus will be zombies, but I'm pretty sure we can relate some of that to the current issues going on for COVID. So please feel free to registrations in. We will be doing the same thing with a live broadcast, and we will get all of that information out to your teachers. You guys can get signed up and be able to participate. For everybody who joined, and that is a high school student, will also receive a nice little goodie bag that will have some snacks and other little things. Since we weren't able to give you guys an actual meal as per our normal cafes. If you guys have any other questions, please feel free to drop them in our chat. If not, we will end our first cafe of fall 2020. Thank you guys all for coming and joining us today.
Yes, thank you, everyone.
Also, a huge thank you to Alicia West. I cannot believe I even just spaced. But Alicia Snyder.
Thank
I'm
you
sorry.
for having me. Thank you for having me, everybody.
All right.
All right. Thank you guys so much. Have a great day.